Ready? Okay, so welcome back. A couple of announcements that Kelsey wants me to make before we get going. This week there is no assignment. You don't have an assignment this week, but you do have a discussion. The discussion is due on Friday, like every other discussion. We will get that posted up today. Exam 2 is on Wednesday this week. Same format as before. There may be a couple of short answer items on there, but otherwise same format. It will be available very early Wednesday. Has to be completed by 11:59 p.m. on Wednesday. So make sure you get it done. No excuses this time, please. You will have 2 attempts like last time. No, it will not give you the answers, okay? So who would ask me that? And people did. You get 2 attempts in case there's like a problem with your internet. You're not hassling me and calling me at fucking 2 in the afternoon, blah, 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 right? So you get 2 attempts. And for those of you working in groups cheating, it gives you more time to sort that out. So you get 2 attempts at it. It is due Wednesday by 11:59 p.m. Oh, there's one other thing that's important. Kelsey and I spoke. This was a 5-week course and a lot of work to squeeze into the 5 weeks. Because we are benevolent and caring, we dropped 1 assignment and 1 discussion from the final points. We are going to send out an announcement this week that gives you the total breakdown so you know how you can calculate your grades. It is not 250 as it says on the syllabus because we dropped 1 assignment and we dropped 1 discussion. So before you start like freaking out because the points aren't perfect, you should be grateful, you bastards, because you have less work, okay? So we'll send out something that lets you know the new breakdown for total points, okay? So don't panic. This is good for you, okay? You have less work to do. We will send you an announcement of the new total points and how to calculate those points, okay? Fair enough? All right. So I'm not going to go into great detail with these last 2 chapters because frankly, these last 2 chapters of the book are kind of a wrap-up of the whole sort of agenda of this book. But I think it fundamentally starts with a central question that we have been asking in the United States probably since FDR's administration. And that is, what is the role of government in healthcare provision for the citizens of the United States? So that's so the 10th chapter wants to address mental health issues associated to poor access to health care. And the final chapter throws out some sort of policy directions that we can think about this. I want to start by framing this question, and maybe your discussion question is going to have something to do with this central issue of basic human, and let's phrase that as citizenship rights. Okay, so if I go around the table to the wonderful graduate students that you met, tell me some fundamental rights of citizenship in the United States. What are some of the fundamental rights of citizenship in the United States?
Right to free speech.
Free speech? What else?
I just said bear arms.
The Second Amendment, right? The right to bear arms. You don't have to be crazy about it, right? I mean, you can be, wow, and today's August 1st. Yay. It's the first day that we're all allowed to carry guns on campus. Who's packing? No, I'm just kidding. Don't tell me. Who's packing? Mike pulls out a fucking cannon, right? So the Second Amendment grants us the right to bear arms. Other rights?
The right of unlawful search and seizure.
Right.
Freedom from unlawful search.
Freedom from search and seizure, right? So the police cannot just barge, right? The police can't barge into your dorm rooms and look for your weed without either a warrant or probable cause, right? What's that?
Or face smell.
Yeah, probable cause, right? So smelling it outside your dorm gives the police probable cause to knock on your door and say, hey, please share. No, I'm just kidding. But yeah, so what's another big right that we have in the United States?
Assembly?
Assembly, freedom of assembly. We're able to gather, voice our grievances, come together in groups. And that was put in there because frankly, under the British rule, that was illegal or largely discouraged. And that's still largely discouraged in many parts of the world, where to assemble in groups, you have to get a permit from the government. In China, if a certain number of people are going to assemble as a group, they've got to get a permit to do it. Okay, so we know that we have all these fundamental rights in the United States, and we also know, of course, for many years, those rights did not apply to people of African descent. Many of these rights did not apply to women. Many of these rights only applied to people that own land, but let's put that aside. In the United States, is there a fundamental right to health care access? Is that one of our rights?
It is now.
No, but
It's like one of
it's
those.
not
that
a
technically-
law. Well, wait a minute.
It is.
It's an executive,
So what?
they
So,
didn't,
so it's not a constitutional right. We don't have a constitutional right. Nowhere in the Constitution does it say that we have a right to health care. But it does say that we have a fundamental right to happiness,
Yeah,
right?
pursuit of-
Liberty, happiness, right? I forget the order all the time, right? But we do have a fundamental right to happiness, right? Does having health care make us happier? So, probably so, right? People with access to health care tend to be happier than people without access to health care. So you could make some sort of tangential claim at least that happiness would involve ensuring that the people in your society are healthy. It is the government's primary duty to protect us, right? That's what we have an army, that's what we have a military. The primary responsibility of government, and at the end of the day, is to protect its citizens. But the question that is often asked is health care a protective measure that the government can engage in? So one of the things that's brought up in the book at this point is the idea that look, in the US, in the United States, health care has historically not been managed as a universal right, right? Has not been managed as something that is managed through the political process. In the United States, healthcare traditionally has been a commodity. In other words, healthcare in the United States runs primarily as something that exists in the marketplace, right? So where do most Americans, I know what you're thinking, Affordable Care Act, Obamacare, before that, right? Where do Americans primarily get their health, and we still do. Where do we primarily get our health care?
Talking about like the ER or?
What's, did you say like emergency rooms?
Yeah. like-
You're thinking at a more micro level. I'm thinking, so we tend to get it through our employers, right? So your healthcare tends to come through a private source. So your employer goes out into the marketplace, works with hospitals, works with HMOs, works with insurance companies to provide its employees healthcare access. Now we do have a somewhat social service component of healthcare, and it has two main elements historically. You know what those are? The two main elements, the two main sources of healthcare provision that aren't private in the United States. So we do have some governmental, which is Medicaid, Medicare. Whatever. Medicaid goes to who? Medicaid, I always forget. Which one goes to old?
One's welfare people.
Yeah, well, let's not call them welfare people.
Sorry, I don't know.
He's so politically incorrect. He said one goes to old people, one goes to welfare people. Which one's for older Americans?
Medicaid.
Medicaid. Medicaid is for lower income, older Americans. And Medicare is for Americans in poverty.
No.
No, what is it? Not in poverty. You're right.
Medicare is for
Yeah, do I have a-
citizens.
Okay, you see, you guys are leading me the wrong way.
And Medicaid is for lower income people.
Yeah,
Lower
carry it.
income.
Let's not stop this.
Are you sure?
Yes.
You're positive?
I'm positive.
Okay. Lower income, Medicare is for,
Permits expire.
August 31st.
CHIP.
Let's not get into specifics.
Before?
Yeah. CHIP is a Texas thing, right?
No, it's
Is it a national? Let's stick with the big ones. Medicaid, Medicare are as close as we've had, what's that?
That's right.
Confirmed.
Confirmed, thank you.
By Wikipedia.
Oh, Wikipedia, that's it. As long as it's on Wikipedia, we're good. Medicaid, Medicare are as close as we have had historically in the United States to sources of healthcare funding that exist outside of a market-based model of providing healthcare. What is one of the big downfalls of both Medicaid and Medicare? What's one of the biggest?
Poor quality?
A lot of people argue that they're poor quality, right? It's a poor quality, yes?
Age?
What do you mean age?
Like, I think Medicaid is for like lower income and 19 and younger, and then Medicare is for 65 years
Okay.
older.
So it misses a lot of people,
Yeah.
right?
People in the middle.
Yeah, so
And
then
you have to
you,
meet criteria outside of age, right, to even qualify to
Right.
receive it. So like if you.
so there's, I think, three biggies. Some people argue that the quality of care is marginal. Secondly, people have argued that these two programs don't cover enough people. As the book tells us, there are at the time the book was written, 48 million uninsured Americans. But then the third one is, frankly, it's the big one. They're going broke, right? They're both going under. How do we pay for these things? These are expensive programs. We spend a lot of our GDP on healthcare. How do we pay for this?
It's in a tax.
With tax revenue, right? We pay through taxes for this. We have an aging society, that more and more people are dropping out of the labor force. They are more and more dependent on government subsidies, and less people are putting in, right? So we currently live in the age of the Affordable Care Act, also known as Obamacare. Obamacare, the Affordable Care Act, that's it, right? Affordable Care Act, is that what it is? The ACA, is an attempt to move healthcare in the United States away from a private market-based model to one based on universal provision for all Americans, right? It is obvious to me that the authors of this book are at a minimum sympathetic to universal health care. Because what they end up doing is often contrasting the United States to other systems. What was South Africa like?
I couldn't say, to be honest. I was still young when I was living there, so I wasn't really aware of that stuff.
You know, I'm not sure what it is in South Africa. I do know that Canada, and particularly in countries like Scandinavia, healthcare has been fundamentally a right of citizenship for decades. So in those countries, if you're a citizen of that country, you never worry about hospital bills because it's provided through, and I don't use it disparagingly, a socialized mechanism. Taxes are gathered. The society as a whole has made a conscious decision that healthcare is a right, affordable. A good way to think about it is compared to the way we think of public schools, right? In the United States, we feel that every child born here, and even some not born here, actually the Supreme Court has cited that even undocumented Americans are entitled to an education. Every American is entitled to a free education in a public school. In Scandinavian countries and Canada, that same logic applies to healthcare, right? Because you're born here, you're entitled fundamentally to this basic right of healthcare. I saw some hands going up.
I was gonna say wealthier, low population countries tend to have that type of healthcare system because it doesn't overload their resources.
Because these are smaller countries?
They have less people living there.
Yeah.
And they're more homogeneous society.
Yeah, I think you're onto something. You know, I mean, if we look at Mike's point is that many of these countries are smaller, they have smaller population base, and they are homogeneous countries, right? Where you don't have large groups of people coming from all over the world all in one place at the same time. So yeah, you're onto something. I saw other hands. Mateen, did you have your hand up?
Yeah, in Turkey,